My name is Tanya Barham. I'm the CEO of a company called Recess. We're based out of Portland, Oregon. And health promotion for me is something that's really important. I spent my whole life in management consulting, energy efficiency, green and renewable energy, but as I progressed further into my career, I realized, you know what, I like working more than I like working out, and I don't have an hour and a half a day to go to the gym or to exercise. I need a way for it to be more integrated with my life. So I think that people have few incentives these days to make time to go to the gym, to make time to care for their health. The average American commutes 26 minutes each way to and from work. In addition, we work longer in America than any other industrialized nation in the world, according to the ILO. So with families, work obligations, commuting, and just generally less access to resources that can help keep us fit and healthy, and actually to the contrary, it's really easy to pick up fast food, but it's hard to get locally grown, fresh, sustainable food, to walk safely and bike safely in parks and city streets. We need a way to give people incentives to take more action with regards to their own health. And I think that there are going to be some systemic things that we're going to need to address. But if we're talking about stimulus in our country, why don't we talk about the $2.2 trillion that we spent on healthcare costs in 2006, 75% of which the CDC estimates are chronic preventable diseases, diseases that could be easily prevented through diet, exercise, and smoking cessation. We've had the information for a long time showing that health is improved, disease is prevented through exercise and positive eating and not smoking and managing our stress. However, I think that we have very few incentives, and societally we're taking more and more away from people's ability to be able to do that. I think offering tax incentives that allow employers to encourage their employees to be more fit at work or during the workday by going to a gym nearby. We spend more of our waking hours every day at work than any other nation in the world, so if we can make it easy for employers to help employees be healthier and take more initiative with regards to their health, I think that's going to be a big step towards improving the quality of life and the health in this country. Of course, also, our healthcare reform is going to be a top priority, and incentivizing both health plans, whether those are private or public health plans, and employers to promote good health in addition for just paying for sicknesses. So, we'll chop off somebody's leg and pay for that through an insurance program, but we won't pay for them to visit a nutritionist or go to a gym every month for months. It just doesn't seem to make sense. And so changing our healthcare system so that we reward healthy behaviors and instead of paying doctors to do extreme measures once people are already sick, I think is also very important. If there's one last thing I'd like to say too about stimulus and money, not just cost savings, it's that, what benefit does this have to employers? Should we write checks to employers who are going bankrupt, or should we help people get more productivity out of their existing workforce? Productivity gains have more or less held still in the United States during the last decade. However, U.S. employers spend $260 billion a year on health and productivity related losses. That's absenteeism and productivity losses due to poor health. So that's not even the cost of medicine that those employers bear out. That's about the same as what we put into the bank stimulus package during the first first investment that we made there. So $260 billion is a lot a year that we could deliver to employers by helping their employees be healthier. And that's just through absenteeism and productivity improvements. So I see this as an important strategic issue for American business, for Americans and their health, and for our quality of life and our prosperity as a nation. I thank you for taking the time to hear me express myself, and all my comrades and friends here at IHRSA. And I hope that we'll be very proactive in this administration in safeguarding the health of Americans. Thank you.